Well, October is Awareness Month for 3 health concerns that impact almost every family: depression, ADHD, and breast cancer. According to the American Cancer Society, about 1 in 8 women in the U.S. will be diagnosed with breast cancer, and 1 in 43 will die from it. But the good news is the death rate has dropped by 44% over the last 36 years, largely because of advances in treatment and early detection. Dr. Elizabeth Nichols, a radiation oncologist at the University of Maryland Greenbaum Comprehensive Cancer Center and the Maryland Proton Treatment Center, joins us to provide more insight. Thank you for joining us.
Thank you for having me.
Absolutely. So let's talk about some of the advances in detecting breast cancer and why has that been so important in this game?
Yeah, so there's been a lot of advances in the treatment and diagnosis of breast cancer over the last several years, which is actually really exciting because we don't always get to say that for all the different types of cancers that are out there. So from an imaging perspective and a detection perspective, there's some new technologies using artificial intelligence that can actually help increase the diagnosis of patients with breast cancer. When it comes to different treatments and so forth, one of the big advances has been in what we call the systemic therapy space. So we used to only talk about chemotherapy.
Right.
Now there's things like immunotherapy and other targeted agents that didn't used to be around even a decade ago. And so now for each different subtype of breast cancer, there's new drugs that we use that target that specific breast cancer as well. And then lastly, for what I do with radiation treatments, there's a new technology that's been around now in our area called proton radiation that can help us treat the tumors much better or the breast tissue much better with minimizing any excess exposure to our normal tissues like the heart and the lung, which of course are very important.
Right.
And there's other new targeted ways that we can deliver the radiation in shorter courses to make it much more convenient for patients and their families.
So how does proton differ from the traditional chemo that we all know?
Yeah, so proton therapy is actually a type of radiation therapy. The regular type of radiation is called photon therapy. And the role of radiation is actually to help prevent the cancer from coming back within the breast. When we think about chemotherapy, we think about that kind of going throughout the body to prevent the cancer from spreading somewhere else. But proton therapy just works a little bit differently in the body than our regular treatments do, and it can help us target the area we want to target and not getting any excess exposure to our normal tissues. So again, it can help us theoretically minimize heart disease down the line for women and lung issues as well, which of course are really important.
So back in my day, cancer was like an old person word, if you will, right? We thought of cancer, we thought older people were getting that, but a lot of younger people are starting to be diagnosed with cancer, even breast cancer. Why do you think that is?
Yeah, so that's a great question, and it's something that we're not 100% sure of the answer. So again, we are seeing higher diagnoses in young patients for breast cancer, but also other cancers like colorectal cancer as well. And right now, the prevailing thought is that it's probably a combination of environmental factors, so things that we eat and that we're exposed to, as well as lifestyle factors as well. Of course, there's always can be a genetic component, and we think about that a little bit more when a cancer is for affecting a younger patient compared to an older patient. And again, that's another area of advancement in that we're able to do a lot more genetic testing for patients as well.
Got it. So let's talk about screening. How important is that, and how early should someone start doing that?
Yeah, screening is the most important thing we can all do to kind of help our health, not only for now, but for the future as well. So the current guidelines recommend that we start screening for breast cancer at the age of 40, or some of the things that people forget are that if you have a family history of breast cancer, you should actually start screening about 10 years younger than your relative did. So for example, if my mom had breast cancer at 42, I should start at 32. In addition to that, we recommended the yearly mammogram. And then the current guidelines from the United States Preventative Task Service say that you don't necessarily have to do a self-exam, but it is still recommended that you do a self-exam so that you can kind of detect something earlier as opposed to later.
So what about, and unfortunately there is a subset of people that never get tested, never know they have cancer, later die from it. So how would someone in that genetic pool know I need to actually go test for it?
Yeah, so that's a great question. And so they would only know either if they themselves were diagnosed or if they had a close family member who was diagnosed as well. There also are some tools out there that your physicians can use to kind of help stratify if someone might be a higher risk compared to a lower risk. But of course, that would mean you have to go and kind of have that conversation.
Let's talk about disparity of people of color. Of course, the death rate for Black females is a little bit higher. What are some of the factors that contribute to that?
Yeah, so there's a couple of different factors that are out there that we know. So one, that when we talk about Black patients or other minorities, there is actually a higher incidence of more aggressive breast cancers compared to the less aggressive breast cancers. So that's certainly one component that's driving that. The second is that we also know that the cancers for different ethnic groups can actually have different genetics to them. So there's been different studies that have been done where they take the same person with the same cancer in terms of the stage and the size, but they look at their different races, and we still find that stage for stage, Black patients can have worse outcomes than their counterparts. And then the other big thing is access to care. So this is something that I think is talked about a little bit more, but where a lot of times patients who have a lower socioeconomic status, which in our area tends to be minority patients or patients of color, oftentimes, it's hard to get to the physician. And they may have to take 3 buses to come see us that takes 2 hours to do. They may not have insurance, or their insurance may put up so many barriers to go see the different specialists and so forth. And so that's an area where a lot of work has been done, and I'm happy to say that, at least in our state, we've had a lot of improvements in that. But again, I think nationally continues to be a big barrier for patients.
Okay. Dr. Nichols, we'll leave it right there. Thank you so much.
Thank you.
And remember, the most proactive measure that women can do to detect breast cancer is to practice self-exams. And at the age of 40, get an annual mammogram. If you suspect something is not right, consult with your doctor. When we come back, we'll discuss depression.
Being a cowboy, I don't know anything different from when I was 3 or 4 years old. I did tough things. I thought everybody needed to do tough things. And if you didn't, I didn't have time for it. I had a very successful career at a very young age, and life was fast. I was preparing physically. I wasn't doing anything mentally on the inside. And then I got hurt. I wanted to be better as a person. And I really dug into mental health. I start my day with 20-minute workouts. I live life 8 seconds at a time. Horses are so therapeutic. They know what you're feeling. When you're nervous, they're nervous. You won't say it back, but we're pals. I take a lot of responsibility in taking care of my kids, my family, and being there for them. You're gonna have tough days. Everybody does. Find a place to stop and just breathe. Love your mind.
When I arrived in the U.S. at 19, I struggled to find job opportunities without a high school diploma. My name is Ariel, and my entire life changed when I took a chance and I got my high school diploma at age 22. Everything I have, my education, my career, my marriage, I owe to the Adult Literacy Center and my teachers. They were with me every step of the way, helping with my English and math, making sure I pushed through all the challenges.
So Ariel, we made this here just for you. It has notes from other people that are here.
Apoyo y orientación que me da.
Your achievement has set an example for so many students. Most importantly, your daughter.
Education was the key that unlocked all my opportunities.
When you graduate, they graduate. Visit finishyourdiploma.org to find free and supportive adult education centers near you.
Well, depression can impact anyone, no matter your age, background, or even circumstance. It's not something people can just snap out of, but with the right treatment plan, feeling better is possible. October marks Depression Awareness Month, and to help us understand it is Dr. Michael Hahn, Chief Medical Staff at Shepherd Pratt in Baltimore. How are you?
Good. How are you?
I am well. Let's talk about depression. What are some of the signs people should look out for when we're talking depression?
That's a great question. So I think it's important first to recognize that depression is different than sadness. You know, we all get sad from time to time, but depression can be potentially a lot more severe and persistent. Depression typically lasts for at least 2 weeks and can sometimes go on much longer than that. And there can be a variety of physical and emotional symptoms that you experience. Emotionally, people may experience things like sadness, feelings of guilt, feelings of hopelessness. Physically, patients might experience things like changes in sleep, changes in appetite, odd aches and pains throughout the body. And in the most severe cases, folks can experience thoughts of death and suicide.
Right.
So it's important that when patients are experiencing these types of symptoms, that they're identified as symptoms of a medical illness and that they access care as quickly as possible.
What are some of the causes, though? Because you mentioned sadness, right? A family member recently passed away. I'm sad because of that.
Absolutely.
But what are some of the causes of that deep depression?
So depression can be caused by a number of different factors. There's risk factors for depression to include things like family history, trauma history. So that can predispose patients to experience a depressive episode if the right psychosocial, as we call it, psychosocial trigger can come along. So for example, a stressful event or a period of grief, the loss of a loved one, can mix with those risk factors and cause somebody to experience a depressive episode.
Why is it so important that families understand and can spot these symptoms?
Well, so depression can hide in plain sight. So whereas somebody on the surface may look like they're experiencing loneliness or moodiness or irritability, they may in fact be experiencing a medical condition that requires treatment. So it's important that families identify that early and create a positive and supportive atmosphere that can encourage that individual to seek out care, because the families and support systems that identify these symptoms early are much more likely to get patients to care early, and early care always leads to better recovery.
So, you know, mental health always has a stigma to it, especially in certain communities, i.e. the Black community. Like, I remember growing up, oh, I'll give you something to cry about, right? Not knowing that maybe I was going through something. So why do you think people may be hesitant to get help?
So the stigma question is one that's been with mental health for quite some time. What I would say to that is that depression is a medical illness. It's the same type of medical illness as something like heart disease or diabetes, and requires treatment. So seeking out care is not a sign of weakness or a character flaw. It's actually one of the bravest and strongest things that anybody can do. So depression is treatable. We have great treatments that can lead to recovery, and there is no need for anybody to suffer in silence.
Yeah, that is so true. For families that might not know what to do, where's a good first step for them?
Great question. So the best first step is to create the conditions where an open and honest conversation can happen. If you identify in a loved one, in your support system, in your community group, in your family, that there are changes that may be suggestive of depression, the best thing to do is to have that open, honest conversation. That lays the groundwork for that individual to more easily be able to access care, either with their primary care doctor, a mental health professional, even hotlines or their local medical clinic. But the most important step is that opening of the door. And families don't have to have all the answers. They just need to be willing to have the conversation.
So let's talk treatment. You know, back in my day, it was like, here, take this pill for this, take this pill for this. But treatment has changed, you know, over the last 30, 40 years. So how is depression treated now?
So depression is very treatable, and we have a variety of treatment techniques in order to treat depression. We customize that to the individual patient needs. But those types of techniques include things like psychotherapy, medication management. Sometimes if the case of depression is more severe, we might call it treatment refractory depression, and we have advanced techniques that are within the last 10, 20 years of development for treatment. Things like transcranial magnetic stimulation, ketamine treatments, those sorts of things. So the thing that I'm the most encouraged by is the fact that today there is more access to care, more research than there ever has been with regard to the treatment of depression. Still not enough.
Right.
But it's going in the right direction.
Yeah, I was going to say there's still probably a gap, though, to actually still get the people suffering from this to seek help, which I think is really important. And with that, what roles can families do to make sure someone's getting help?
Absolutely. So again, the most important thing is to create that positive and supportive environment in order to open the door for that conversation to occur. They don't have to have all the answers. The most important thing for families is to make sure that they provide that emotional support and to help that individual access care. When we conceptualize a patient's care as a psychiatrist or as a mental health professional, we look at something called a biopsychosocial formulation, which is our shorthand for saying that the biological, psychological, and social factors are all critical for the care of the patient, social in particular.
Right.
Depression can often leave us feeling isolated or alone, and that can be a barrier to accessing care. So what families can do is to try and combat that, to try and provide that support, and to, again, not necessarily have all the answers, but just to show that they don't have to suffer in silence.
Yeah. So Shepherd Pratt, what resources do you offer folks?
So Shepherd Pratt is an outstanding system with a wide continuum of care for mental health services, over 380 treatment locations throughout the state of Maryland, and lots of different levels of care in order for us to meet the needs of each and every individual patient. Our Care Finder tool is an excellent way to navigate the system, to get access to resources and to get pointed in the right direction. But we have everything from outpatient care to our day hospital programs, which is a little bit more acute level of care, a little bit more intensive level of care, but you still go home at the end of the day. We have our residential treatment programs. The Retreat is one for patients with complex and more advanced cases. We have our Institute for Advanced Diagnostics and Therapeutics, where we have some of those new and innovative neuromodulation techniques that we talked about before, and are as well conducting groundbreaking research in various fields, such as psychedelic treatment for the treatment of depression. Got it. Last question in about 20 seconds. As we celebrate Depression Awareness Month, or as we mark this, what's one thing you think viewers should really take away from this? I think the most important thing to know is that depression is treatable. There is hope. The most important thing is to access care and to have access to those resources. But there is no reason to suffer in silence. And if you access that care, it's only likely that we can get you to recovery. All right, Dr. Hahn, we'll leave it right there. Thank you so much. Depression can impact anyone. It's important to recognize the signs and symptoms and connect with resources to recover. To learn more, visit shepherdpratt.org. When we come back after these messages, Dr. Allison Pritchard of Kennedy Krieger Institute in Baltimore will provide insight on attention deficit hyperactivity disorder, commonly known as ADHD.
1 in 3 adults has prediabetes. This puts them at increased risk for type 2 diabetes, heart attack, and kidney disease. The good news? Prediabetes can be reversed. Follow along with this 1-minute risk test to learn your risk for prediabetes. Are you over 40? That's 1 point. Over 50? That's another. Over 60? Add 1 more. If you're a man, give yourself a point. Family history of diabetes? Add a point. Have high blood pressure? Add another. Not physically active? That's a point. Are you slightly overweight? That's 1 point. Pretty overweight? That's 2. Very overweight? That's 3. A score of 5 or more means you likely have prediabetes, so talk with your doctor. Learn how you can change the outcome at doihaveprediabetes.org.
Hear that? That's the sound of your life. Perfectly imperfect. Beating in rhythm to the world you've created. But every time you drive after drinking, the music gets drowned out. Your life sounds pretty great. Don't let a buzz ruin it. Buzzed driving is drunk driving. Don't drive buzzed.
So we likely all know someone who can't focus, is overly active, impulsive, and extremely emotional. This could be signs of attention deficit hyperactivity disorder. Although we more commonly hear ADHD, we need to better understand it and how to interact with those who have it. October is ADHD Awareness Month, and Dr. Allison Pritchard, co-director of the Department of Neuropsychology at Kennedy Krieger, joins us to share more. How are you?
I'm great. How are you?
I am excellent. Thank you so much. So you just told me something before we started. ADHD is different than depression. How so?
Yes, ADHD is different than depression. So ADHD is a neurodevelopmental disorder. That's kind of how it's classified. And what that means is that it starts when children's brains are still developing. So you tend to see the symptoms of ADHD begin during childhood. Not always, but most often.
Right. So with that, what are some of the signs parents can look for in their child?
So ADHD looks a little bit different depending on the child's age, right? And we always say if you've seen a kid with ADHD, you've seen one kid with ADHD.
Right.
It looks a little bit different for each child. I really liked your introduction because I think you captured really nicely that it can look like problems with attention, it can look like problems with behavior, it can look like problems with emotion. And so some things that we want parents to look for with younger children are difficulty sitting still. That's a very common one with younger children. Difficulty following directions. So I tell you to go get your jacket and your shoes from your room, and maybe you come back just with the jacket, right? As kids get older and start school, parents of children with ADHD will often hear from teachers saying, oh, they're really having trouble sitting still in class, they're talking out of turn, or they're failing to turn in their homework. And then as children get into sort of middle school and high school, some of the executive functions, things like planning and organization, time management, become a bigger problem typically.
So here's the thing, and again, just growing up in a black household, and I know a lot of black families, and not just black families, but there is a subset of parents that, oh, it's just a bad kid, I need to discipline them. Like, so how do we get away from that?
It's really hard. I will say that I've been seeing kids with ADHD for 15 years, and I have a hard time coming up with a handful of kids that I've seen who didn't want to do the best that they could or didn't want to make their parents proud, I think that certainly more awareness about ADHD is absolutely necessary, and understanding that this is something that really is outside of the child's control. So we talk about ADHD as a difficulty with regulation, regulating attention, regulating emotion, regulating behavior. And so really recognizing that that is something that isn't entirely under the child's control can be really helpful.
And with the awareness, what are some of the misconceptions that we don't want people to have?
Well, the one that you just mentioned is a primary one, right? That these are just bad kids, or that they're lazy kids. Parents often say, oh, my child's not doing their homework, they're just lazy, right? And the fact of the matter is, we actually know from research that children with ADHD have to work harder to achieve the same results as children who don't have ADHD. So they really are working very hard at it, but they're not getting the same results out in many cases. So I think, for parents and teachers to keep that in mind can be really helpful.
But with proper treatment, they can function normally, would you say?
Yeah, so I think that what we typically recommend is a combination of treatment and support, right? So treatment, most often medication is kind of the frontline treatment for ADHD, and we have tons of research suggesting that medication works really well for many, many children at treating the symptoms. But even for kids for whom medication works well, supporting the symptoms is also really important. So we typically recommend that families talk with the child's school and get some supports and accommodations in place in the school setting. Often that'll be a 504 plan or an IEP to kind of formalize those supports. And the kinds of supports that children with ADHD often benefit from in school can be things like taking assessments or tests in a separate room where it's quieter so they don't get distracted as easily, having extended time on assessments, or even just more frequent reminders from the teacher to kind of come back to whatever the task is that they're doing. At home, parents, I always recommend that parents work with a mental health provider, a psychologist, social worker, who can help them kind of problem solve the specific issues that they're running into at home with the child, whether that's they're constantly late or they can't get their morning routine done, right? And try to figure out how best to manage that at home, help parents get some ideas about that.
What are some of the downfalls if this goes untreated?
There is a lot of research at this point that shows that children with ADHD who don't receive treatment have worse outcomes across the board. So we definitely see worse academic outcomes. Children are less likely to graduate from high school if they don't receive treatment. They're more likely to be underemployed if they don't receive treatment. More concerning even is the fact that children who don't receive treatment are at higher risk for being involved in automobile accidents, getting injured, involvement with the criminal justice system, drug and alcohol involvement. So it's really, really important for these children to get treated.
Right. Last question. We got about 20 seconds. If someone suspects their child is suffering from ADHD, what's their first step?
The first step is to talk to your pediatrician. Pediatricians are great. They, in some cases, they can make the diagnosis themselves and begin treatment. In other cases, they'll point the parent in the right direction, but they're really the front line.
All right, Dr. Pritchard, thank you so much.
Thank you.
All right. Well, today on Community Connections, we address 3 health concerns that can impact any individual, any family: breast cancer, depression, and ADHD. This month, learn more about these conditions and make connections to be screened, treated, and live healthier lives.